Service for Neurosurgery and Spine Surgery at Hoag Hospital, Newport Beach. And it's my pleasure to welcome you to our third in a series of 3 spine lectures. The first one was about diagnosis, the second one was about treatment options, and the third one is this one about minimally invasive surgical options. So let's recap a little bit about diagnosis because it is just so important. What does diagnosis mean? It means when you go to your doctor, you're trying to find out what's wrong, what the problem may be. And the patient may be complaining of back pain, neck pain, radiating symptoms down the arm. Diagnosis is figuring out where is it coming from. That's what the first lecture is about, and please feel free to take a look at that. The second talk was about treatment options, and it's not all about surgery. In fact, surgery is one tiny aspect of treatment options. There's a whole variety of treatment options. And review that second lecture to learn more about that. But that includes surgery, minimally invasive options and traditional, but also includes physical therapy, pain management, injections, epidurals, acupuncture, massage, yoga, Pilates, so on and so forth. So surgery is just one piece of that. Lastly, in today's lecture, we really want to talk about minimally invasive spine surgical options. So that's the focus today. So what does minimally invasive mean? Because there's minimally invasive other types of surgery as well. Minimally invasive is really the surgeon's conscious effort to preserve soft tissue. Soft tissue includes the skin, the muscles, the ligaments, the tendons. Those are all important elements. So when we look at the spine, for example, what doesn't show here is the layers of muscle, tendon, ligament, skin, all encompassing around these tissues. Those are very important. Without that, we'd just be a skeleton. And with the soft tissues, we have structure, we have movement, we have strength. And that's why physical therapy, for example, is very important. That's why core strengthening is very important. So if a surgeon cuts through tissue and destroys some of the soft tissue on their way in, some amount is inevitable, but destroying more than you need could be dangerous. And that's why there's a big difference between minimally invasive surgery and traditional surgery. Traditional surgery may mean a surgeon's going to make a big cut up and down, many inches long, and open up so that you can see the spine itself across multiple levels. Now, sometimes we have to do surgery that way and there's no alternative. So some types of surgery must be done that way. But I'm happy to say that most of spine surgery these days can be done through minimally invasive techniques. So when I make a smaller incision, what are the benefits besides just cosmetics? More importantly, we preserve some of those soft tissues. So we cut less, we destroy less of the muscle. You have less bleeding, you have less pain, you have less chance of infection. All of this is critically important. When you hurt less and you bleed less, patients will be more apt to get up and walk and move around. Physical therapy will be easier. Movement will be less painful. That's important also because if a patient's not getting out of bed because they have too much pain, they have a higher risk of other complications like a pneumonia, like a urinary infection, like a DVT, a blood clot. These are all higher risk when patients can't get up out of bed. So minimally invasive techniques allow all these risks and complications to be far less than through traditional means. So minimally invasively, we can do spinal fusions, we can do discectomies, we can do laminectomies, we can even remove tumors and treat some types of scoliosis through minimally invasive techniques. This is really important. So once your physician helps you diagnose the problem, then you want to ask him or her about treatment options, and hopefully minimally invasive or less invasive techniques can be included among them. So let me give you some examples. Sometimes we need to do a spinal fusion. So let's say the spine is unstable. It's tilting too much one way, or rotating, or it's slipping back and forth, or there's been a fracture. Maybe a bone has been cracked or broken. Sometimes we need to put in screws and rods like this. So this is an example of spinal instrumentation. It's just one type. There are many types. And this could extend over multiple levels, such that it gives structure and stability, sort of like a building. If a building were tipping one way or the other, you may put a scaffolding around that building to support it. So sometimes we'll put in screws and rods like this to help create a scaffold. But that by itself is not enough. You have to do some type of fusion if you're worrying about structure and stability. So what does fusion mean? Fusion means we want bone to grow somewhere. Here's an example of sometimes we'll remove the disc. So look at here, we've removed the disc from a lateral or a side approach. Sometimes we'll remove it from an anterior approach, from the front. Sometimes we'll do it from the back. And it all depends on where the pathology is, where the problem is. Again, that takes us back to diagnosis. If you diagnose where the problem is, you can hone in on a treatment option that's really focused in on where the problem is coming from, and then you can treat it less invasively. If you didn't make a good diagnosis and you don't know where it's from, you may have to open a much larger area and create more damage to the soft tissues. And you may not even find where the original problem is coming from. So again, I keep going back to diagnosis, and that's so important. So getting to spinal fusion, so let's say the problem was at this level. I've removed the disc material, and now this area will collapse if I put nothing in it. So oftentimes we'll put a cage or a spacer, just like this. It's made out of plastic. And we fill it with bone graft, and we insert it into that disc space. Now the bone over time will grow through that cage, and that'll become more solid, sort of like cement. So that'll get stronger and stronger. So that's one type. Another type is through an anterior approach, which means from the front. So this is coming in from the belly. And sometimes that's the best way to go in and to fix a problem. So in this case, we've removed some disc material, and I've placed a cage. And this cage has a metal plate and screws, 3 screws that go into the bone. That can help stabilize this area as well. So this is an example of also a spinal fusion combined with instrumentation, all in one. And sometimes we don't need to even put in these screws and rods, and we have other options like this. So another example is what's a device called an ISP. That stands for interspinous process device. And this is a device that's put in between this part of the bone that's called the spinous process. So it basically looks like a clamp. So what we'll do is basically, here's the spinous process on this model. We can open this space up during surgery, clean out the space that's compressing the nerves, and then if we don't put anything, it may collapse back down. But in this case, we've put in a clamp that helps keep the space open, and it helps stabilize that area as well. So sometimes we'll put in a device like this. And the decompression, also, I don't want to skip over. These are examples I've shown of stabilizing or fusing the spine. Sometimes all we need to do is clean out that area. So let me give you an example. So here we're looking at the spinal canal. So this hole right here, this tunnel, is where the spinal cord is coming through and down, and then the nerves are coming out left and right, like roots on a tree. But sometimes that tunnel is narrow, so instead of being wide open, it's really tight. When we get really tight compression of the nerves, we can develop pain, back pain, numbness or tingling down the legs. And so one version of those symptoms is called spinal stenosis. Again, that's the tunnel that's getting really narrow around the nerves. So sometimes we'll go in, and all we want to do is just make the tunnel bigger. So I'll go in with a drill or different tools and just make the space open around the nerves. That could be quite effective in a patient, for example, that is not unstable, so doesn't need instrumentation, but does have compression of the nerves. So we're trying to free up the nerves. That's a very effective surgery, and we can do that through a tiny incision, less than an inch long, because I'm working through a microscope. There's another example of how you can do minimally invasive surgery is when you have tools like an intraoperative microscope. because when you make a small cut, it could be hard to see. But if you can make a small cut and work through a microscope, then I can magnify and illuminate the field, and I can see much better. So these are examples of some lumbar surgeries. What's an example of a cervical? Cervical is the neck. Well, sometimes we'll go in and we'll do a fusion, just like with the lumbar spine, but we'll do it of the neck. And most of you have probably heard of plates and screws and fusion of the neck as well. So that's done very commonly. An alternative to a fusion of the neck is a placement of an artificial disc. It's sometimes called an ADR, artificial disc replacement. So what is that? Well, if this is the neck, and this is one bone, and this is one bone, and in this example we've removed the disc because we've determined that the disc is not holding up that space and is maybe herniated, maybe compressing on the nerves. So I've gone in and removed the disc. Now you have the choice of putting in a plate, screws, rods, fusing the neck. If you did that, then there's no motion of this. The alternative is to do the ADR, or the artificial disc replacement of the cervical spine. So we've put in a joint into this space, and now what that allows is the neck can still move around. It can rotate, it can flex, it can extend. This bending motion is still allowed with an ADR. That's a great option for many people. Not everyone, but sometimes an artificial disc replacement is a better alternative to fusion. So these are just different examples of some types of spinal surgeries. We talked a little bit about minimally invasive surgical options. Again, that's where we're trying to accomplish the same end results, whether a decompression, a fusion, rod placement, but we're trying to do it through a less invasive surgical option to preserve the soft tissues, to have less complications and less blood loss and less pain. We're trying to speed up the recovery, to get the patient out of the hospital, to get the patient back home, to get the patient walking, moving, eating, drinking, playing with the family, getting back to work as soon as possible. All that's really, really important, especially these days where there are a lot of challenges around us and viruses and so on. So it's very important to try to look at all your options. We talked about treatment options in the last lecture. Today we talked about minimally invasive surgical options. There are many others as well. This is just a foot in the door to kind of get the taste for some of these options that are available. Again, talk to your surgeon because you may or may not be a candidate for these, and there may be better options for you as well. In future lectures, we'll focus in on specific diagnoses. We can talk more about spinal stenosis. We can talk more about degenerative disc disease, herniated discs, and so on. And we can talk more about different instrumentation techniques, some surgical tools that make our job easier, like robotics, spinal navigation. These are all exciting areas that we'll touch on in future lectures. So thanks for joining me today. We're going to check on some online questions that some viewers may have.
Do you offer or refer chronic back pain sufferers to learn how neuroplasticity may contribute to pain?
So one viewer is asking about referrals to learn about neuroplasticity. And so what this refers to is the nerves are very complicated parts of our body. They transmit, like wires, they transmit messages from our brains to the end organ, which may be to our fingers, toes, our arms and our legs to enable movement. But along that pathway, the nerves can be damaged, injured, or hurt in one way or another. So there are very important techniques that are actually part of the concept of neuroplasticity, physical therapy, soft tissue manipulation management, some types of chiropractics, yoga, massage. All of these actually enable some of these techniques for nerve recovery, nerve health. It's very important. So the answer is yes. I think that neuroplasticity is an important element, that's incorporated into soft tissue healing. There are some therapists, some providers who are very skilled in it, and that's something that I think is an important part of recovery. Checking if we have any other questions.
That's it, I'm surprised.
All right. So thank you for joining us today, and tune in for future lectures about other areas like we discussed. Thank you. Have a good evening.